Welcome to the SSM Health Dean Medical Group Orthopedic Surgery Information. This presentation is intended to provide information to help prepare you for your surgery. It isn't necessary to take notes. The information and additional information can be found in your surgery folder. Your surgery will be performed at SSM Health Surgery Center on Park Street. Before surgery pre-op coordination services. You will receive 2 to 3 calls before surgery from the SSM Health Pre-op Coordination Services Department. The pre-op specialist will call at least 2 to 4 weeks before your surgery to obtain prior authorization from insurance if it is needed and answer questions regarding disability, FMLA, or workers' compensation forms. They will also assist with scheduling some appointments. Another call will be made closer to your surgery date to review your medical history. And you will receive a call 1 to 2 business days before your surgery to notify you of your arrival time, the time to stop eating and drinking, and other details. Plan to stop eating at midnight. You may drink clear liquids up to 3 hours before your surgery unless told otherwise in that phone call. Insurance. As mentioned, the pre-op specialist will obtain prior authorization through your insurance company if it is needed. It is recommended that you contact your insurance company to verify that you have active coverage, that SSM Health is an in-network provider for your insurance, and if you have any out-of-pocket costs. Your surgeon's office will provide you with the procedure codes that the insurance company will need. Forms. If your employer gives you disability or FMLA forms for your time off work, the forms can be emailed, faxed to the SSM Health Disability Department, or taken to patient services at one of the SSM Health clinics rather than your surgeon's office. For more details, refer to the Disability Insurance FMLA or Medical Information Forms sheet in your folder. Permission for verbal communication. To protect your privacy, SSM Health staff cannot speak with individuals or leave messages regarding your healthcare treatment unless you specifically give permission to do so. In your surgery folder or binder is a form titled Healthcare Permission for Verbal Communications and/or to leave messages. By completing the form, you can give permission for staff to communicate with individuals listed on the form and/or leave detailed information on voicemail. Pre-op physical exam. A physical is required to ensure that you are medically ready for surgery. The orthopedic clinical staff will tell you if the pre-op physical exam should be scheduled with your primary provider or if it will be done by an orthopedic physician assistant. The pre-op physical needs to be done within 3 to 30 days before surgery, but having it within 14 to 29 days is preferable in case additional tests or appointments are needed. Skin preparation before surgery. You will be receiving 2 bottles of Hibiclin's chlorhexidine gluconate antibacterial soap. Please follow the written instructions that are included with the bottles. ME surgical videos. SSM Health uses a patient education program called ME. ME is a web-based program that takes medical information and explains it in a way that is easy to understand in the format of short videos. If ME has a video appropriate to your surgery, you will receive an email or phone call within 30 days of your surgery letting you know how to access it. Day of surgery. Plan to be at the hospital for 4 to 8 hours. You will check in at the front desk on the 2nd floor of the outpatient center. A nurse will take you to the pre-op area. Your family is welcome to accompany you to the pre-op area. There you will meet with your anesthesiologist and surgeon. When it is time for your surgery, your family will be directed to the waiting room. Directly after surgery, you will go to a post-anesthesia care unit to be closely monitored before going to step-down recovery. Once in step-down recovery, your family can join you. You will need a driver to take you home and someone to stay with you overnight and the following day. Day after surgery. You can expect a phone call from the SSM Health Surgery Center nursing staff the first business day after your surgery to check to see how you are doing. Appointments after surgery. Your first few orthopedic follow-up appointments and therapy appointments will be scheduled for you by the pre-op specialist and discussed during the phone call 2 to 4 weeks before surgery. Methods of comfort after surgery. Cold therapy, elevation of the surgical area, and position changes are ways to help with pain after surgery. Cold therapy can be in the form of cold packs, crushed ice in a bag, or cryocuff. Cryocuff is a cold therapy unit which has a cuff that wraps around the surgical site. Cryocuff. If you would like to use a cryocuff for your shoulder or knee surgery, SSM Health Physical Therapy can provide you with one. SSM Health offers the non-motorized aircast cryocuff. Other cryocuff options, such as motorized versions or cryocuffs for other body parts, can be found online. It is best to get this before surgery. For more details, refer to the cryocuff information in your folder. Pain relief. You will be provided with a prescription for pain medication before your discharge. If a refill of pain medication is needed, you must send a MyChart message or call the orthopedic department Monday through Friday between 8 a.m. and 4:30 p.m. Your prescription may not be filled the same day as your request. Therefore, please request refills 48 to 72 hours in advance of needing the medication. Preventing blood clots. If you do not normally take a blood thinning medication, you will be instructed to take something to thin your blood after surgery. The most common medication used is aspirin. The strength of aspirin and directions will be on the discharge paperwork from the SSM Surgery Center. Dean on Call. Dean on Call is available after hours if you have concerns. Dean on Call will not be able to refill pain medication prescriptions. Thank you for watching. Please review the information in your folder. If you have questions, contact your surgeon's office through MyChart or by calling 608-294-6464.